Okay, good morning, everyone, to the Wednesday, November 10th media briefing. We'll get started with our Acting Medical Officer of Health, Dr. Shankar Nazathuri. Doctor?
Great. Thanks, Mike. And colleagues in the media, thanks for allowing me to speak today and sharing a few comments. Later today, the letter of instruction will be modified so that young people who are just turning 12 will have a 3-month grace period to get vaccinated. So if your child turns 12 next month, they can continue to participate in hockey or other recreational activities. And during that 3-month grace period, they can get vaccinated. And the letter of instruction will be amended to reflect that, and that should be released later today. I have my colleague Eric here who can help with any of the operational or comment on the operational items. I also wanted to introduce Karen Belmore, my colleague from the nutrition service. Karen is a registered dietitian, and healthy eating, nutrition, food preparation are all public health priorities. And I think sometimes it's easy to overlook the other public health priorities beyond COVID. But we really have tried to make healthy nutrition a priority. She has produced a series of videos with the team, and she's going to comment further on the programming to support nutrition and on these videos. So maybe I can pass it on to Karen, Mike, if that's okay with you.
That sounds good.
Okay.
Great, thank you very much, and good morning, everyone. As stated, I'm Karen Belmore, and I'm a registered dietitian with our chronic disease and injury prevention team. And I'm here today to kind of continue that conversation that was started on Monday around healthy eating and our You Can Cook program. So as Nicole mentioned on Monday, there is a very clear link between healthy eating habits and lifelong health. And we know through the research that we've done locally that residents who are male, as well as those who are single, separated, divorced, or widowed, report eating less fruits and vegetables than what is recommended compared to those females or married and common law residents. And when we look at kind of that demographic, we can see that these are the people who primarily are not necessarily cooking for themselves because they're not really traditionally encouraged to participate in the cooking process. So we wanted to learn a little bit more about the why. Why does this group have lower intake of vegetable and fruits? And what factors related to food skills might be creating this environment? And when we did some more deep dive into the research, we realized that males 18 and older, as well as those who are single, separated, divorced, or widowed, shared some common traits. The first is that they have a low self-perceived food skills and often were embarrassed about this deficiency in front of peers who had higher levels of confidence and skills. And it was really interesting to note that as engagement happened at an earlier age, there was actually higher food skills later on in life. And the other factor was that men tend to be more isolated than women. So when the social context of eating was removed, the male's capacity for action was really reduced because eating became more of a necessity than a pleasure or social entity. So social isolation was found to increase the potential for food vulnerability, which really means lacking nutrition or having at risk of malnutrition. So in addition, there really has been a decline in domestic food preparation skills overall across the board, all of Canada, most of North America. And it's really because of the lack of introduction to or opportunity to learn cooking skills from parents, from grandparents, or in the school environment. So using what we learned with all of this research, we created this online program that can be accessed in the comfort of your own home, reducing the possibility of embarrassment for those who are not as confident in their food skills and may not traditionally engage in an in-person food skills program. So to kind of go over a little bit about what you're going to get with this program. So we cover 15 different food skills throughout the program. And we start with the basics of setting up your kitchen. So really going over a list of the tools that you need, because without the proper tools, it's going to be really hard to execute the rest of the videos. From then we move into 2 different knife skills videos. So teaching how to be safe while cooking, because we do know that there is a little bit of hesitation around using knives and knife skills. So building up that confidence through those videos. And these 3 really prepare the viewer for the rest of the series. And we do space them out every other week. And this is providing a lot of opportunity for practice prior to moving into the other skills. So once those 3 are done, we move into how to learn how to use 1 or 2 ingredient cooking methods. So we cover how to cook eggs, how to roast vegetables, how to use plant-based proteins, how to break down a whole chicken, cooking different types of meat, cooking pastas and grains, how to make your own dough, and different ways to cook oatmeal. And really collectively, these videos will give the viewer a variety of skills, and it sets the tone for the last section. But if those were the only ones watched, there's a huge skill set created in order to be able to feed yourself. And the final videos of the series put all of it together. So we make a sheet pan dinner. We learn how to change the spices used to change the style of cuisine you're eating. We learn how to make or fix mistakes in the kitchen, and a few different ways to put those delicious meals all together. So I would like to show now kind of our trailer of the series. It's a 30-second clip just to set up what you would learn over the 15 weeks. Oops. 1 second. There we go. So that is just a little brief clip of all of the things that you learn. And as you can see in the trailer, the equipment used was very accessible and non-intimidating. We utilized a hot plate and a small oven to do the cooking in. Most recipes require just 1 pot or pan in order to kind of reduce the burden of dishes after, which we know can also be a barrier to cooking. And we do actually use a lot of products that are very economical, cost-effective, and we teach how to use them in the best way so that not only are you cooking for yourself, but you're not spending a fortune doing so. The 5-minute time frame really makes the videos easy to digest, and it doesn't leave out any of the skills though. The time that is removed is just the cooking, the oven doing the job for you. So we really hope that the groups identified, as well as the all community members, are able to see that it's okay to learn food skills at any age, find comfort in learning within their own home, and are able to start sharing these new skills with others, because we do know that food is more than just nourishing the body, but it helps to nourish the soul, and sharing a meal is a really important part about keeping connected socially. And that is it. So thank you.
Thank you, Karen. There was some audio issues, but I believe Eric has provided the webpage in the chat room for the media if they'd like to go check out the videos. Today we'll start with Taylor from the Windsor Star.
Yes, good morning, Doctor. Good morning, Karen. Karen, a question for you. The findings about men 18 and older, single, divorced, widowed people, and the lack of perceived food skills that they have about themselves, was that data collected by the health unit? Were those health unit findings, or was it external parties that found that came to those conclusions?
So we did have some data when we did our community needs assessment back in 2018, I believe, that helped informed and kind of had us dig deeper into other literature. So it was a combination of both.
Okay, thank you. That's everything for now.
Yeah, and if I could share, just to supplement Karen's comment, social isolation is a public health challenge from my estimation. It affects other domains beyond food, but it affects health broadly. And I think it's a very important point that Karen highlighted is that people that are more isolated are likely to spend less of their energies, time, or attention on cooking, and that affects their nutritional status. So it's an interrelated challenge, but it's something that we should focus our energies on as a community.
Thank you, Doctor.
Any questions from AIM 800?
Good morning, Doctor. Just in regards to the letter update, is this an update to the letter that was issued at the end of September that went into effect on October 1st?
Eric, can you just comment because it's a very technical issue, a technical question?
Yes. So hi, Rob. Eric Madeline. I'm the Director of Health Promotion at the Health Unit. So yeah, that's the letter that went into effect on October 4th, actually.
Okay, so I just want to make sure I have it right. So now if an individual is 11 years old right now, but they're turning 12 within the next 3 months, they're eligible to go into these recreational facilities as long as they get the vaccine within that 3-month period?
So once they turn 12, they have a 3-month grace period during which they can receive both doses of the vaccine without being excluded from sport and recreation activities.
Okay, thank you. So if they're 12 now and they only have 1 dose, they have that 3-month grace period to get their second dose. So there's, as of right now, they're still allowed in the facility as long as they have 1 dose.
We'll be posting the letter. It has the exact wording will be posted to our website at 9:30 today, and we'll be doing a release with a little bit more detail. But essentially, anyone that is within 3 months of their 12th birthday, following their birthday, they'll still be required to provide identification to prove that they're within 3 months of that birthday, but they're not required to provide proof of being fully vaccinated. Does that answer your question?
Yes, no, thank you.
Okay.
Any questions from CTV?
Yeah, good morning, everyone. I'm kind of late to the party, so got a couple of questions that I'm not sure if we've touched on. But first of all, this video, I love the idea. So is this based on numbers, and what numbers are there? Or have you already talked about that?
So I think I'll ask Karen. I think the question you're asking is, was the NIDIS for producing these videos based on some data and experience?
Yes, exactly. Yeah.
Yes, thank you for the question. Yeah, we have used a lot of research to try to inform this program. It was originally supposed to be in person prior to the pandemic hitting. But as we kind of had the opportunity to pause, we were able to kind of research really what would be a effective means of getting food skills out to that population, and digitally was actually showing greater success. And again, the males and those who are singled, separated, widowed, or divorced, that came from our community needs assessment that we did locally, as well as supported by kind of research globally, that target group is those who lack food skills kind of the most.
Okay, so was there a large number of that population that, are we talking hundreds, we talking thousands?
We don't have like an exact number,
okay,
but we are looking at, I believe it was around that like 30% range, where it was the consumption of fruits and vegetables was the lowest, and it was because of the lack of preparation. So we use the indicator that we use for healthy eating is whether or not an individual is eating 5 or more fruits or vegetables a day. And then we can kind of look into why they wouldn't be achieving that goal.
Got it. Okay, that's good. And then sidebar, fourth wave echo is what my director sent me. Not sure what the echo part means, but any comment on this fourth wave that we've sort of fallen back into?
Well, we monitor the data and the number of cases and the number of people self-isolating and other metrics related to the burden of illness. And we're going to continue to monitor that. I think there is a concern that there's a province-wide that there might be signals of an increasing number of cases. I think we have to wait for what the data might ultimately show. And as it relates to the province, we might want to hear what the provincial chief medical officer of health might state. We can provide when do we release our EPI summary? Is it later this week?
We'll be releasing it Friday, Dr. Nezathuri.
Yeah, so we might try to comment a bit more on that on Friday on where our local situation is.
Okay, I know. I remember in the past when I used to jump on these calls, there was always that 3-week period where the ripple would take that long to get here. So, you know, I'm just wondering if you guys were mindful of that and kind of looking at that, you know, having heard about this fourth wave already. So, but yeah, no, we'll wait for the numbers. That's fair.
Yeah, we are mindful. We are mindful because, among other things, that as the fall and winter comes along, more people are going to be spending time indoors interacting with each other, and there's more likely to have transmission indoors than outdoors. Also, we are concerned about the flu season, and will there be an increase in, or we are concerned about an increase in the number of flu cases. So we have this at least double challenge, which is one is we want to control COVID, but we also want to control the flu. And both of those can be effectuated by a vaccination programming.
Right, exactly. Okay, very good. Thank you, Doctor.
You're welcome.
Any questions from CBC?
Yes, good morning. Doctor, can you explain what prompted you to change the letter of instruction and introduce that grace period? Was this based on feedback from the public at all?
Well, we always try to do better. You know, whenever we promulgate rules and directions, we try in the first instance of the Public Health Service to be cautious and circumspect about what are the mandates and requirements. Also, we're constantly receiving that feedback and dialogue from the community, and we try to incorporate that in our plan moving forward. The case counts today, when we've made this modification, are better than it was when the letter of instruction was initially promulgated. So that also weighs in the decision making. The Public Health Service has always recognized the importance of trying to improve the quality of life of young people, and we all recognize that COVID has disproportionately affected young people. So to the extent that we'll have young people turning 12, we don't want them to have an interruption in their athletic programming. If they were playing hockey and they're 11 today and they turn 12 tomorrow morning or 12 tomorrow, we think at this point in the pandemic that a 3-month grace period would be a sufficient balance of risk and benefit for them to participate in sport and yet at the same time get vaccinated in a timely manner.
Thank you. And the take-home PCR test program for school children is supposed to launch next week, at least according to an announcement from the province a few weeks ago. Do you have any updates on whether those tests will be available locally, what that rollout will look like? And Doctor, I know you've made your views known on the utility of mass testing. Do you plan to offer these tests in certain scenarios?
Well, we always leave every option to manage COVID open. And, you know, this is a medical question. And in medicine, you order a test when you think that the benefit of ordering the test exceeds the risk or the burden to the person getting the test. It's also true at a population health or a community level. Whenever you order a test, you have to think, well, will that test help me manage the public health? And in situations where we think that ordering widespread testing would benefit the public health, we would definitely include that in the way we manage outbreaks. So I would say that we continue to keep all of our options open, anything that involves the school board and the school district, we have to have dialogue and consensus with the schools, and that's something we engage with on a regular basis with the schools. So I think we continue to monitor. The bottom line is we continue to monitor the situation. There may be a role for testing. That role is likely quite limited, and we'll see how things go as we move through the pandemic at this point.
Thank you.
Sorry, I was on mute. Any questions from Blackburn?
Yes. First one is for Karen. I guess, how has the response been to You Can Cook? I noticed that you do have a number of episodes up on the web page. Have you had a lot of downloads? Have you had a lot of views?
Thank you for that question. The teaser trailer, I know, got a lot of traction. The views on the YouTube page aren't quite as high as kind of the views on Facebook. So we would like everyone to go over to the YouTube page and view over there. But so far we're getting a lot of really positive feedback. We are encouraged that people are watching the videos. And I would mention that this morning our roasted vegetable video did get released. And so the next video will be in 2 weeks. And we wanted to make sure that people had enough time to practice the skill instead of bombarding them with options. And come March, we will be doing a little bit more of a wrap-up contest survey to really find the success of the program. But we're looking at our views and our interactions as we go along, and we'll modify as needed in terms of promotion.
Do you think that this might be more popular than it would have been in person? You mentioned that a lot of these people are embarrassed by their cooking skills. This is something that they can do in their home, and nobody needs to know that they don't know how to use a knife.
Exactly. And actually I think it was a perfect storm outcome. When we were offering it, we didn't have as much registration. It was a pretty low uptake. And compared to the views that we're having now, I do think it's a benefit. I think more people over the pandemic tried to navigate their kitchen a little bit more if they were able to. And so this is just a quick and easy, very friendly, non-intimidating way to get in there and try something new.
Also, I wanted to ask you, Dr. Nezathuri, about, as you know, Health Canada is changing the labels on the AstraZeneca and the Janssen vaccines to warn of autoimmune complications. Have we had any local cases of immune thrombocytopenia, or I'm sorry, venous thromboembolism related to these vaccines?
Yeah, actually, can you send an email question for that? Because I've only been I've only served in this capacity for a limited period of time. As a general construct, those are relatively rare phenomenon, and it's immune thrombocytopenia and venous thromboembolism, I think, is what they're talking about in those labels. I think as a generic question, the number of people who actually receive those vaccines in the health district, perhaps Eric, do you have information on the number of people in Windsor-Essex who actually received those two vaccines?
No, I don't actually. So if you wanted to submit that through email, we could look into it and get back to you, Adele.
Sure, that would be fantastic. The last question I had is that Pfizer's now been approved for the third shot for all adults. I know that at this point, your priority is first and second, and just getting those that are unvaccinated to be protected. But is this something that you would recommend once it becomes available to the health unit?
Yeah, so vaccine programming and vaccine distribution is the policy is set by both the federal and the provincial authorities. I think that the provincial and federal authorities will be reviewing this, including NACI, to make a final determination about the third shots. We already have a constituency that are getting third injections, and they're currently being vaccinated throughout the health district. And so I would anticipate that there will be an expansion of criterion for who receives the third injections. The exact timetable for that and which age groups are going to receive that, I think we'll have to wait for provincial direction.
Thank you very much.
You're welcome.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thanks, Mike.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
I'm good too. Thank you.
Thank you, everyone. Just want to remind the group that our offices are closed to the public tomorrow for Remembrance Day. So our next media briefing will be on Monday, November 15th. And we will send out the EPI report. I will send an email once it's ready on Friday morning. Okay,
All right.
thank you, everyone.
All the
Thank
best.
you.
Good day.
Bye-bye.
Cheers.
Bye.